Christmas now just days away, health leaders remain very concerned about another surge in COVID-19 cases. The Omicron variant also a concern globally. Ballad Health today reports 240 COVID-19 patients in their hospitals. 64 patients are in intensive care, 48 patients are on ventilators, and today 4 children are being treated for COVID-19 at the Niswonger Children's Hospital. Joining us now is Chief Infection Prevention Officer for Ballad Health. This is Jamie Swift. Jamie, you had indicated before you were concerned that we were starting to see a surge. Are you still concerned that we're starting to see another surge in our region?
I am. We're really maintaining that high level of cases right now. We're seeing a number of new cases each day, and our hospitalizations are remaining high. I think certainly every expectation is that cases will continue to increase from Delta, and then, of course, with Omicron as it comes into the region.
You all are, while caring, also projecting and preparing. What are you preparing for this surge in terms of numbers of people hospitalized?
Now, I think people need to be prepared for the fact when Omicron gets here, we're going to see a very large influx of positive cases. And so we're still really trying to understand the world data better to make sure that we can have some good projections for hospitalizations. We know that regardless of how high we may go, that with the sheer volume of cases we'll have with Omicron, hospitalizations will go up. Our model right now has that varying between several hundred. We really need some more data to find that up within the next week or so. We're confident we can. We really just need to see what's happening in places like South Africa, in Denmark, in New York City, and some of these places that we'll be able to see what that hospitalization rate is truly going to be in a population such as ours. I am concerned that given our vaccine rate, we will continue to see higher hospitalizations in other areas at times.
Is that because the variant appears to be just so easily transmitted? Is that the part of the Omicron picture here that makes you concerned about hospitalizations?
It is, and I really want people to understand this variant is so much more contagious than what we've ever seen. So even though Delta was so contagious, this is really going to overtake and overshadow Delta. And what we're seeing is if you're not vaccinated and boosted, you're really going to be at risk. This variant seems to evade immunity from past infections, so we really can't rely on that. So vaccine is going to be the key to get us through this next wave. Okay,
let's talk about the vaccine. I think the idea of the breakthrough case is becoming something that we're hearing about more. But in terms of the hospitalization and in terms of the seriously ill, you had been seeing very few of them were vaccinated. Very few of them were boosted. Where does that stand tonight?
That is still 100% the case. So as you all know, some days we have 0% of our hospitalized patients are actually vaccinated if they're in with COVID. Some days that can range from 5 to 10% may be vaccinated, but we continue to see that those patients often do not end up in the ICU, do not end up on ventilators. So honestly, on any given day, anywhere from 90 to 100% of our COVID patients are unvaccinated.
All right, it's been months since some people had their 2 shots. I mean, many months, as in, the first part of 2021, since some of them had, some people in our region. So are we starting to, or could we start to see now the emergence of people who are getting COVID, who got their 2 shots but didn't get the booster? And does that underline the need for that booster?
Yeah, we've seen that with Delta. We have seen some breakthrough infections with Delta. We will see more with Omicron, and that's what people really need to understand. Now, it's very natural after 2 vaccines to have that waning immunity, to see the breakthrough cases with Delta. Not surprising. So we came in and made this 3rd dose, that booster. That really gives some excellent protection, especially against Delta. It certainly helps against Omicron. It's going to be critical when Omicron gets here. So if you've not had your booster, now is the time to go get it.
Let's talk about flu. I know last year flu was almost non-existent. A lot of people had different theories for why. I know you have said you felt it was because we were isolating, washing our hands, wearing masks, and doing all the things that help stop any viral transmission. But now we have flu season here. What are you seeing, and what can you give us in terms of clarity to what we're hearing about the effectiveness of the vaccine for the flu this year?
Yeah, I'm also extremely concerned about flu. We are definitely seeing an increase in our region. Last week alone, we saw about 160 flu cases in our hospitals, in our EDs. Our outpatient centers saw almost another 300 cases. So that was within a week's time. So we have really seen the emergence of flu. It appears to be mainly flu A. Typically, if it remains to be this H3N2 season, sometimes that's not a good match for the vaccine. That being said, vaccine is still extremely important for flu as well, because even if it's not a great match, it gives you that little bit of immunity that will get you through that illness. So extremely concerned about flu, also encouraging people to go get your flu shot. Flu is here. We continue to expect it to circulate as well.
Now, I want to narrow down on this. You're saying even though maybe you're hearing that this year's vaccine isn't a perfect match, you're saying still get the vaccine because even if it isn't a perfect match, it can help reduce the severity of the flu?
Absolutely. We have seen this every year that it's not a perfect match. It still gives you a little bit of a boost. And so that is really important to have that vaccine on board. Even if it's not a perfect match, that is also one of those vaccines that if you get ill, you should have a milder case. It should keep you out of the hospital.
Real quickly, we will not see you again before Christmas in terms of Ask the Expert segment. Are you at the point where you would say to people, before you go to a gathering, you need to know who's not been vaccinated there?
We're really encouraging families to have those discussions and determine what you're comfortable with. If you have a high-risk individual, I certainly would be having those conversations. Do everything you can to protect everyone that's at your gathering. Ideally, of course, I'm going to say yes, we want everyone to be vaccinated and boosted and be open about that. But certainly, if you're not, then you all need to determine as a family what your plans are, who's going to be there. If there's going to be unvaccinated individuals, are there other high-risk individuals that you need to take measures to protect, such as masking, opening windows, anything that you can do to lower those risks to those high-risk individuals will help.
Jamie Swift, thank you, and Merry Christmas. We appreciate you so much.
Thank you. Merry Christmas.